President Cyril Ramaphosa has encouraged South Africans to get vaccinated after he received the Johnson & Johnson injection. He hailed the arrival of the 80,000 Johnson & Johnson doses last night as an achievement for the country. Ramaphosa was speaking at the Khayelitsha District Hospital, where he was the 6th South African to receive the injection after healthcare workers.
And I must say that at first I was a bit terrified of this long needle that was going to be embedded into my arm, but it happened so quickly, so easily. It was just a prick on my flesh, and I really did not feel much pain. This day represents a real milestone for us as South Africans, that finally the vaccines are here and they are being administered. And I was rather pleased that there were 5 people who were vaccinated before me, and they are health workers, and it was a joy to watch them to see whether anything had happened to them, and gladly nothing had happened to them. And it means that being vaccinated is a fairly straightforward process. And I'd like to invite South Africans to take this up so that we can all be safe, we can all be healthy. But I also want to thank the Minister for having worked so hard. Minister Mkhize spent sleepless nights making sure that the change from the earlier vaccines that we had acquired, which proved not to be so effective against the variant we have, happened so quickly and so smoothly.
Now, the president reiterated the readiness of all 9 provinces to roll out the vaccines to healthcare workers in the initial phase.
I did say that our provinces are really ready for the vaccination process, and I was glad to see that they've trained people. There are many people who were trained here. They were earlier trained for the AstraZeneca vaccine, and they had to change very fast to start training people for the Johnson & Johnson vaccine. Now it does show that our health system is robust, it's agile, it's effective, and our health workers are able to get up to speed very, very quickly. And I saw a real army of our health workers, all knowledgeable about what we are now doing. Now this is really a milestone, as I said, for our country, and we are going to be rolling out this vaccine throughout the country. It's already started in a number of health centers, and I think it's going to be flawless. I think it's going to be done effectively, and as we get more and more of these vaccines, as the Minister brings them in, I think we will be able to vaccinate up to the 40 million South Africans that we should.
Meanwhile, Health Minister Dr. Mkhize also received the injection in Cape Town. Mkhize says government anticipates more doses from Pfizer next month. He adds that by the second quarter of the year, South Africa should have around 7 million doses from Pfizer of the 20 million ordered. Now, the Pfizer-BioNTech injection is highly effective against the new variant and requires 2 doses.
We are anticipating also that there will be additional doses that will come from Pfizer, and within the next month there will be a number of those that will be coming through. Initially, we actually are expecting about 500,000 of those doses. So when they come, we'll simply continue with the vaccination, which in fact means that we will have vaccinated the first 500,000 if we are able to deal with that, and then of course the next 500,000, all of those will be the first doses. We've learned from research that you can do 1 dose, and then between 3 and 4 weeks, or up to even 6 weeks, we're still safe to go. But we've actually learned from the UK that we can actually wait for 3 months, which means we can actually vaccinate a large number of people within the period, so that everyone gets the initial protection, and thereafter will then come with the second doses. We are expecting that by June we have a commitment from Pfizer of about 7 million doses. That should be coming here, and I must indicate that this is all because we've actually asked for consideration for South Africa being the epicenter in the continent, and the fact that with the raging second wave that we've gone through, we then asked to change all the plans that they had. So we had to renegotiate all of them.
Now, the minister adds that the second phase of the rollout plan will include cabinet ministers, religious leaders, traditional leaders, and other influential people to build confidence.
Most of those will come in onto the next batch. There's phase 2. Most of the cabinet will come on phase 2. Most of the leaders, religious leaders, traditional leaders, artists and musicians and so on, influential people in those particular different categories, they're all ready. Taxis, transport, and so on, they're all ready to come in the next phase. So the slight difference, there are constraints in this one that was defined in a protocol, which is allowing us to do the numbers that we're doing, because we said priority is health workers. Then the rest are going to be phase 2, where we're looking for various categories of our workers to be participating, as well as ensuring that those who lead in those categories must appear in the forefront. So we'll deal with them in that way.
Well, that was, of course, the first rollout of the vaccines, with the first batch now of the Johnson & Johnson vaccines having arrived in South Africa. Various civil society groups are raising their concerns around the country's rollout plan. Joining me now to voice their concerns is Right to Know Gauteng coordinator Bongani Mthembu, as well as the president of the Young Nurses Indaba Trade Union, Lerato Madumo. Good evening to you both, and thank you very much for joining us.
Yeah, good evening. Good evening.
Lerato, I want to...
Good evening.
Yeah, Lerato, I want to start with you. I mean, hearing from the president now after taking his jab, he says two things. He says our health system is robust and agile and efficient enough to be able to handle this rollout. But he says health workers are able to get up to speed quickly in terms of what they need to do. Is this your experience?
It's absolutely not true. I think what is fundamentally important to note is that we went into this pandemic already with a healthcare system that was in a crisis. So to utter those statements is really a false. The pandemic itself exposed us as healthcare workers in quite a great deal, and we find ourselves, just honestly wanting with the rollout that we are seeing that is half-baked. I can tell you right now, we are simply on a PR exercise, trying to lobby as many people who, like they've said, that are influential to take the first step, because at the shop floor, at the ground, healthcare workers are not as eager. Hesitancy is you can actually slice it with a knife. That's how people have lost their faith in the government of the day. So we have no agile. In fact, we have got a very much dilapidated healthcare system. A healthcare system was not going to even be ready for NHI, let alone to fight this particular pandemic.
Yeah. Let's talk at that level, at the shop level, where the tires hit the ground, so to speak. What is the level of readiness? What are the flaws that are in place?
Let me just shock you. The centers that are identified as vaccination centers, when we checked with members on various institutions where it's said these members are going to be able to assist, some of them were not even aware. I mean, in the Free State alone, we got a shock of our lives when we were told that student nurses were being only trained yesterday. And imagine using student nurses that are not qualified to want to do this rollout. That's really shameful. And I mean, your big hospitals like Steve Biko alone, even up to during the day today, they were saying this. We've got news from the department to say, as leaders of unions, let's go and instill some faith in the people and get a jab. Our position really has been the same. The rollout plan is completely flawed. We are really rushed, and we've said in a pandemic there is no emergency. We don't see the need for this rush of this half-baked rollout system, and we've called for caution. And we've even said, even at the time of the first injection that we're here, that it was going to fail. We are here with the second batch. a different manufacturer altogether, we are still saying, hold up, this thing must be well thought of. Politicians are meddling. I mean, they are really meddling in issues that must be decided by scientists, by researchers, and clinicians.
Right. I'm going to come back to you in a moment, Lerato, because I want to get to a sense of who is really against it or not supporting this particular rollout at this point. Is it those who have vaccine hesitancy because they just don't have enough information about it, or they are anti-vaxxers who are just completely opposed to the idea of vaccination? But Bongani, let me bring you in here. Let's talk about the level of transparency. We've got now the 80,000 Johnson & Johnson vaccines in the country. What do we know about the process that SAPRA went through or is still going through? I mean, I have information at the time, which probably you will correct me, that SAPRA is still going to give the approval for this vaccine, but they are being rolled out now as if they would have been rolled out continuing with the trials that had been going on. But what do we know about their arrival up to this point? Bongani?
Hello.
Yeah,
yes,
go for it.
Yes. No. Basically, that's what we wanted to know from the department itself. That what the number of quantity of the vaccine has arrived, exact number, and then and how are they going to roll out the proper plan of where if the frontliners are going to start, which are the 5 frontliners and which department are targeted. Because remember, COVID-19, when it arrived and when the president started to announce the SNDF was part of that, SAPS, and all these other departments that are related. So we are saying, as Africa, we need a proper plan, because as we speak now, things are not clearly, even though the president has spoken that we start here and so on. So we are not sure that plan will work as they indicated, because we don't see, because people are still confused and so on. Even the spot, the institution that will assist, where people will go and do those vaccination and so on, are not clear, are not properly been planned, because around the country, municipalities are confused where people need to take the very same vaccination. The clinics are going to be available to do that, the hospitals and so on. So we need a proper plan, and the government should respond in that urgently, because we have less than 40 days, in terms of making sure that this vaccination is outlined, because we are told that the very same vaccine is expiring at April. So what is the next plan? What is the contingency plan to make sure that it reach across South Africans as far as 40 million as they claim? So those are the things that we wanted to consultize the department, that you need to make sure you address those issues. And the most important one, the issue of the advantage, because we have this entrepreneur will take advantage of this rollout of vaccine. Who are the people responsible to make sure that the vaccine transported from point A to point B, point C, and how and so on? So how is safe is that is going to make sure that people will get it and won't be able to have some other extra delays and so on and so on. So we can see that there's a lot of unplanned. There's no proper planning of the whole thing in terms of the rollout. It was just something that needs to be done quickly and so on. But really, it doesn't go well with us as we see things from distance as right today. So there are a lot of issues that need to be clear and which are not clear. So the government is just doing things as if things are working on the ground. Things are very, very different. People, they don't know even the name of the very same vaccine and so on. So we need government to respond properly with the proper plan. People who should be known and upfront. And after the front line from the department, who are the next, which week and which date and so on. Such things, we need them to be communicated on upfront, and people who should know what is that, and so on and so on.
Well, Lerato Madumo is still with us. She's the president of the Young Nurses Union, as well as the Gauteng coordinator for Right to Know, Bongani Kamthembu, with us. Now, Lerato, let's talk about what the nurses are saying. I mean, as opposed to Zoliswa there, who's clearly excited to be receiving the jab. You're saying there are nurses on the ground who are hesitant. Are they hesitant because they just need more information, and once they are informed, they might have a different view, or are they just anti-vaccine? Okay, Lerato, I think you're muted there. If you can unmute for us.
All right.
Yeah.
I don't think there is literally any healthcare provider or any nurse that could say they're anti-vaccine. The challenge or the hesitancy that comes with the current state of affairs is that from the beginning of this pandemic, training, development, and ensuring that healthcare workers are signed off competent has been really lurking. It is now also only last week when online training for just a few were really, snuggled in. So yes, lack of information is at the center stage of what is causing hesitancy. But at the same time is also lack of transparency and, being downright to say, look, everyone knows that no one is going to be forced to take the vaccine. You do it on your own free will. It is a trial, so things can go wrong and things can go bad. But the actual information that is contained, and in fact, even the rollout plan itself remains very unclear to the healthcare workers. As Ubongani said, I mean, you just catch on with what is happening with the wave, and it's really an unsettling mode. And I think also our government has really failed at ensuring that we deal with perceptions and misconceptions, as well as any other information that is not correct, particularly because you have put this whole thing as if you are caring for the healthcare workers, and the healthcare workers are saying, but hold up, from the beginning you've not given us protection. You've left us to contract this COVID-19, and some of us have even lost the battle and have died. So why do we have to even trust you? So that lack of trust has not patched between the employer and the workers, and it's going to be a very difficult exercise that the employer is going to embark on, because currently, as you ask, on the shop floor, on the ground, really healthcare workers are divided. Those who would go because they want to appease the employer, or they think, perhaps this will help you. Remember, like I'm saying, we are champions of vaccines, whether it's child vaccines or it's flu vaccines, and those have been tested over a period of time. There's never been a time where healthcare workers are at a position where they have got to be guinea pigs. And I think that is also a bit unsettling for them. And there are no guarantees. Even if they get this jab, it doesn't mean they can't contract it. Yeah. The fundamentals, the basis must still be covered. Right. The nurses must still be given appropriate PPE. Yes. Our healthcare centers must be resourced enough. Like in the Eastern Cape, where this thing is being celebrated, we laugh because they are letting go of healthcare workers who were, working for COVID-19 contracts. But we are still right when in the middle of COVID-19, right. As just qualified nurses across the country have not been absorbed to take their roles to uplift the burden that we are currently facing. So we ask ourselves, this all of a sudden in miracle vaccine, it's not going to take away the actual problems on the ground. We need infrastructure. We need facilities that are really going to help us fight the COVID-19. Just the vaccine alone, it's really us, going chasing our tails, to be honest.
Let's talk about those fundamentals, Lerato. You're talking about online training. I mean, what does it look like, for the general public? They would be worried. They would need to know what level of training are the nurses receiving? What does it look like practically? And will they know when they face a nurse that the nurse actually knows what they're doing?
So I've gone through the modules that is shared by the Department of Health, and I can tell you, even a grade 10 would have put on a proper, PowerPoint presentations. But at the same time, remember, this is a skill. And it's also not just about the theoretical aspect. The practical aspects also plays a very fundamental role. And in this online trainings, it also doesn't instill that much of confidence because there isn't practice where in every skill that a nurse or a doctor performs, they need to be signed off competent. That also does not come out very strong in this. Hence, we are really, speaking down on the actions of, the department wanting to even use student nurses, because we know our enrolled nursing assistants, our enrolled nurses also cannot just give injections. They need, only registered nurses can do that. And also, they also need to be competent, and they must have understand even what, the pharmacokinetics and the pharmacodynamics of these drugs, so that should anything go wrong during the procedure and even after, they're able to assist. Yeah. So if the people that are giving the jab are not confident, you can imagine where the community is at right now with all the conspiracy theories that are running. There isn't really much confidence there.
Bongane, on the broader vaccine rollout strategy, we are in the dark, I suppose, on the question of the pricing. And you're saying this is the question you want to directly put to the vaccine task team. What is the price? How much are they paying? What do we know, in terms of how much is being used? I think Treasury has given a ballpark figure of what the entire rollout is going to cost.
Definitely, Tisa, because that's what we are worried about, because now we smell a very, very, very the same situation that we experienced during the PPE, this company, that, and people are connected and so on, but still are not doing proper job that they're supposed to do and deliver the PPE. So even now, we still asking ourselves, that's why we are asking even the department that should be transparent and be able to tell what is really the amount that was spent in order to buy all this vaccine, and the vaccine that we have now in the country, what quantity we have, and we're able to roll out until when, and then how, the target of the people that we have targeted, how many of them, is it in line with what the president has said on previous statement that he said that we'll be able to target more than 40 million as indicated. So those are the things we need. Even the treasury to be transparent and tell us this is the amount that we spent, this is what we have bought, and be able to make sure that everybody will be able to get this vaccine, even though the very same vaccine, how safe it is as we speak, and the most important thing, you must also answer the expiring of it, because we were told that next April it won't be working, so because it will be expired.
So I mean, when the minister was doorstopped by one of our reporters yesterday, he wanted to reiterate that point, and he said the vaccines have not expired. Let it be known that is false. The vaccines, the AstraZeneca vaccines, were not expired. Right? That's one of the things that he said. But we're hearing from the president now that there's somehow some kind of negotiation that has happened with the African Union for them to take the vaccine. An offer has been made to them, and there's been interest that has been raised to take over those vaccines. So the money will not be wasteful expenditure in a sense, because those vaccines will be going into the continent, and there'll be some kind of deal, I suppose, that will be struck there. But that is one of the issues that you're also raising, that you need to hear from the president what the plan is as far as assisting the rest of the continent with vaccines, because you're saying if all of us are not vaccinated, then none of us are safe.
Yes, definitely, because that's why the worrying part. So as we know this, the department and the government are saying this, but on the ground, there's no information that is sort of arriving well, because we have platform of media, your local community radio stations that can be utilized by the very same officials that people will be able to listen and be able to get information on time and be able to utilize it properly and attend to those institutions. So we are just saying the information should be there, and not only on one channel, to every platform that you utilize, because on the ground and the local level, the confusion is there. As the Ratuke, we run around and we ask people, we check and we monitor that how this thing, because even today we are told that this is the first day where we'll be able, there will be the roll out, but still we are not satisfied with the way things are sort of done. We welcome that they are also continuously trying to make sure that it arrives, but how and when and who's the first and who's the next, and so on and so on. So those things should also be communicated properly, and then we will to run away from the confusion and entertain negative things that won't be able to assist the nation in dealing with the very same virus that is killing our people.
Nganagam Timba, appreciate your time. Thank you very much for joining us. Gauteng Coordinator for Right to Know, as well as the President of the Young Nurses Indaba Trade Union, Lerato Madumo.